It is my pleasure to introduce Amanda Bigus. She is a community outreach specialist for Trellis with an extensive background in aging services. In her role at the Area Agency on Aging and the Senior Linkage Line, Amanda connects organizations to resources to support an aging population and provide free community presentations, such as this presentation today on Medicare.gov and healthcare fraud. Please join me in welcoming Amanda.
All right, thank you. Everybody hear me okay? Got my microphone here. Can you hear me all right? Okay, I got a thumbs up. Wonderful. Well, thank you so much for joining me today at this session. If you are already on Medicare, you know that open enrollment is coming up soon, October 15th through December 7th. So you might be wanting to take a look at your Medicare plan, make some changes, or you might be coming close to Medicare age, and you might be starting to think about what you need to do to get ready for Medicare. So today we're going to talk a little bit about the importance of, one, doing your research and really finding a Medicare plan that's right for you. But we're also really going to highlight a tool that will help you find those different options that you can use yourself, and that's Medicare.gov. Before we get into that today, I am going to talk a little bit about Senior Linkage Line. So I am a community outreach specialist with Trellis. We are the Area Agency on Aging for the 7-county metro area. And we partner with the Senior Linkage Line. Senior Linkage Line is a statewide service of the Minnesota Board on Aging. And we're housed in all 87 counties in Minnesota through 6 different contact centers. It's important to know that we do not market, endorse, promote any insurance products, okay? We have no financial gain in any decisions you make. So our main goal is to try to find Medicare options that are going to be best for you. And as we'll talk today, you'll see that one Medicare plan might not work the same for somebody that it does for somebody else, okay? Senior Linkage Line specialists and volunteers are trained in Medicare and long-term care options counseling. We are what's known as Minnesota State Health Insurance Assistance Program, or SHIP for short. Each state does have a SHIP office in Minnesota, that's the Senior Linkage Line, but each state does have that and has a resource line, just like the Senior Linkage Line. We're also Minnesota's Senior Medicare Patrol. We're trained to fight healthcare fraud, waste, and abuse. I know this afternoon there's going to be a presentation on fraud and scams, so that's a really important topic that we also work really hard to prevent and to educate people how to protect themselves on. And we also provide resources and assistance to remain in the community. Now, Senior Linkage Line does a lot of work around Medicare. We answer questions, we help people compare plans, we help you decide whether or not you should enroll when you first become eligible. We are a really great source of support, okay? But we also provide a lot of different resources, help, assistance on a lot of other topics. So you can always call us for things like housing options, transportation, food support, caregiver support. Even though we're called Senior Linkage Line, you don't have to be a certain age to call. Anybody of any age can call to get these resources. So if you're somebody who is caring for an older adult or a family member, you can call us to get some resources. Now, as I mentioned, we cover all 87 counties in Minnesota. We're a statewide service of the Minnesota Board on Aging. We are available Monday through Friday, 8 a.m. to 4:30 p.m., so you can call us anytime in there. The Trellis office is located in Arden Hills. Trellis, as an area agency on aging, does a lot of other things in the metro area and statewide, and some other states as well. But we're here really to focus on Senior Linkage Line and Medicare.gov. If you're interested to learn more about Trellis, you can always visit our website, trellisconnects.org, to find out the other resources and programs that we have available for older adults. Now, these are a few things about the Senior Linkage Line that are very important. First of all, we are free. So anytime you call Senior Linkage Line, we're not going to charge you anything. Okay, we are funded through state and federal dollars. So anytime you call Senior Linkage Line, anytime you attend a presentation or get anything mailed to you, attend a Medicare counseling appointment, no charge to you, okay? We're also neutral, okay? We are not, as I mentioned, going to recommend one service or provider over another. This is especially important when it comes to Medicare. You know that if you are on Medicare or if you are coming eligible to Medicare soon, you're gonna start getting a lot of things in the mail about Medicare. Anybody getting things in the mail about, yeah, I see some hands, yeah. So a lot of times when you're getting these things, they might not have your best interests at heart, okay? They might say things like, you could save this much money on a Medicare plan. Well, that's when you read the fine print and it says, not affiliated with Medicare, right? Senior Linkage Line is completely unbiased, so we are going to help you find a plan that is best for you. So we do have your best interests at heart. We are trying to find what's going to work for you. And we're objective, so I always say, if you want Senior Linkage Line to make a decision for you, well, we're not gonna do that. But what we're going to do is we're gonna talk through some of your best options and help you make an informed choice. There's a couple different ways that you can connect with us. So you can call us, 800-333-2433. If you can remember 3, you're halfway there. We've got a lot of 3s in the number. Again, we're available Monday through Friday, 8 a.m. to 4:30. You can also visit us in person. I'm going to talk a little bit about our Medicare counseling appointments. We have over 30 different locations in the Twin Cities metro area where you can attend a free Medicare counseling session. You can visit our website online, and you can also use a chat option. MinnesotaHelp.info is a website where Senior Linkage Line accesses all of their resources. So you can go to Minnesota Help, you can do your own research, it's like Google for the human services, okay? But if you are on Minnesota Help and you have some questions that come up, there is a chat option on Minnesota Help. So you can chat with a live Senior Linkage Line specialist just like you would do if you call the Senior Linkage Line. Okay? Same hours as Senior Linkage Line, Monday through Friday, 8 a.m. to 4:30. Okay? So lots of different ways that you can connect with us. We also have lots of different volunteer opportunities. I have a wonderful volunteer with me here today who's going to be talking about Medicare.gov. But he is a Medicare counselor, also does presentations for us. So that is a couple different ways that you can help us as a volunteer. But we also have people who do administrative tasks for us. They are out in the community doing events like our lovely volunteers back at our Senior Linkage Line table. We have volunteers who are ambassadors for us, helping in communities where maybe English isn't the first language. So they're helping with some forms assistance or translating materials, things like that. So if you're ever interested in volunteering with us, please let us know. Okay, so we're here today to talk about Medicare.gov. The focus of this conference is technology. And at Senior Linkage Line, we are really focused on empowering people to do their research when it comes to Medicare and seeking help and seeking tools that can help you in the process. It is a really complicated and complex thing. Anybody here already on Medicare? Let's see some hands. Okay, so we've got a few folks on Medicare. Anybody really close to Medicare age? Okay, so you might have started to do some research, started to look into your options, started to think about when you might want to enroll in Medicare. If you're already on Medicare, as I mentioned, we've got that open enrollment period for Medicare coming up, October 15th through December 7th. make sure to review anything that comes from your plan very carefully. Plans can make changes every year in premiums, deductibles, benefits covered, service area covered. So you want to make sure to do a review of your plan and then maybe compare some plans to see if there might be a better fit for you. Okay. What we're going to do before I hand it over to John to do a tutorial of Medicare.gov is to just briefly do a quick overview of the different parts of Medicare. In order to kind of understand what we're looking at when we look at Medicare.gov, I think it's important to understand some of the terminology and some of the different parts. So stick with me on this part because Medicare is not that exciting. I know, I get that. But it is important to understand these different parts. So we've got the A, B, C's, and D's of Medicare. We've got our hospital insurance, which is Medicare Part A. This helps cover inpatient hospital stays, skilled nursing care, home health care, and hospice care. We've got Medicare Part B, which is your doctor's insurance. This helps pay for outpatient hospital stays, doctor's visits, preventative care, some therapies, diagnostic tests and shots, durable medical equipment, things like that. Together, Parts A and B are what's known as Original Medicare. Okay? I'm going to skip over there to Part D. That's your prescription drug coverage. Okay? Now, in the middle there, we have Part C, or what's more commonly known as a Medicare Advantage plan. This is a bundled plan that combines all those different parts of Medicare together. Okay? We're going to talk through a little bit more about what that means, but this here are the different parts. So you may hear Part A, Part B, Part D, and Medicare Advantage plans, which are also Part C. So when you are enrolling in Medicare, you have a couple different options in terms of how you're going to receive your Medicare coverage. Okay? Now the first way here is Original Medicare. As I mentioned, that includes Part A, Part B, your hospital insurance, your doctor's insurance. But the thing to know about Medicare is that it was never intended to cover 100% of your costs or services. So once your deductible is met, Medicare covers 80% and you have 20% left that you are still responsible for out-of-pocket costs. So you have that optional coverage there. You can purchase a Medigap policy to help cover those out-of-pocket costs. There is also the Medicare Part D plan, your prescription drug coverage. Now you may notice that that's under optional coverage. You do not have to purchase a Part D plan. However, it is good to know that if you do not have other creditable coverage, you may face a penalty later down the line if you decide to enroll in a Part D plan and did not enroll when you were first eligible. So something to keep in mind. There are some Part D plans that have a low premium, as low as $4.60 a monthly premium. So you might have to weigh the benefits and risks of either enrolling in a Part D plan when maybe you don't take any prescriptions, or waiting until you need them and then possibly facing a penalty. Okay. Now, option 2 for your Medicare coverage are these Medicare health plans. Now, I mentioned the Medicare Advantage plan. That is a bundled plan. They're sold through private insurance companies. So once you enroll in a Medicare Advantage plan, that insurance company is going to become the payer of your plan. Original Medicare no longer covers anything. Okay? Medicare Advantage plans combine Part A, Part B, sometimes Part D. Now, if the Medicare Advantage plan does not include prescription drug coverage, you cannot purchase a separate Part D policy. So if you need prescription drug coverage, you need to make sure that your Medicare Advantage plan is going to have that in the plan. Okay? And the Medicare Advantage plan can cover some additional benefits that Original Medicare may not cover. Vision, dental, hearing, transportation, things like that. Medicare Advantage plans are very different from plan to plan, and that's why we're going to walk through the plan finder today on Medicare.gov to show how you can look at the different plans and compare those plans to find what might be best for you. Now you see here there's also a cost plan option. Cost plans are very similar to Medicare Advantage plans, but they're only available in 21 counties in Minnesota. You might be from one of those counties here in Minnesota, and if you are, a cost plan is available to you. So you might want to do some research to see if your county does have that. But I can tell you that none of the metro area counties have a cost plan. So if you live in the metro area, a cost plan is not an option for you. But they are similar to a Medicare Advantage plan where they bundle all of those different parts of Medicare. They're sold through private insurance companies. A main difference is that with a cost plan, you can purchase a separate Part D plan with the cost plan. And it really is a nice plan if you like to travel. You know, let's say you spend your summer in Minnesota and the winter in Arizona, right? Somewhere warmer than here in Minnesota. The cost plan is going to pay here in Minnesota when you're in network, and when you travel to Arizona or Florida, wherever that may be, where you escape to in the wintertime, original Medicare is going to come in and cover for you, okay? So it's a really nice plan for people who travel. Again, only available in 21 counties. A lot of times people ask me, what's the best option? What should I choose, right? I can tell you that there is no one best option for everybody. Everybody is different. It's gonna work differently for everybody. You know, sometimes we see where somebody says, well, I chose this Medicare Advantage plan because my neighbor said it was a really great plan and it works well for her, so I enrolled, but it doesn't cover my prescriptions. The premium's too high. It doesn't have my doctors in the network. So you really do need to do your research to make sure that it's going to be a plan that works well for you. Now I have here up on the screen kind of some comparisons with cost, convenience, and coverage. These are some things to think about as you are looking at the two different options. I'm not going to go through all of these in depth, but just know that in Minnesota, 49% of people have original Medicare and 51% of people have a Medicare Advantage plan. So it's pretty split down the middle. That just kind of shows you that it really depends on you and your situation of what's going to work best. Okay, so before I hand it over to John, I do want to let you know, first of all, Trellis and the Senior Linkage line are available for Medicare help. That's one area where we are very strong. Our Senior Linkage line specialists answer questions. They can walk through Medicare.gov with you. They can help you decide whether or not you need to enroll when you first are eligible when you turn 65, or if you can delay that Medicare coverage until you retire or stop working. We also have Medicare counselors who do free 1-hour counseling sessions with you. So you meet with a Medicare counselor. John here is one of our Medicare counselors, and you go through your specific situation, okay? Talk about what's important for you to have covered. Talk about you know, what your financial situation might be, what's important to you. And our Medicare counselors can compare plans with you. Now there's 106 different Medicare Advantage plans in Minnesota. It's overwhelming, okay? About 45 in the Twin Cities metro area, so that kind of whittles it down a little bit if you're in the metro area, but still a lot to choose from. Now I mentioned those things that you're getting in the mail from different insurance companies or Medicare plans, and they might present you with, you know, 3 different options. Well, I'm gonna tell you, they might get financial gain from those options if you choose one, okay? Our Medicare counselors are gonna start with all plans and whittle down to what's going to be best for you. And then they'll give you a handful of options and help you make an informed choice. Again, we're going to empower you to make the decision that's best for you, all right? Now, Medicare.gov is a really great tool. It has a plan finder on there, and you can use this for Medicare Advantage plans, and you can use it for Part D prescription drug plans. I would encourage you, you know, if you have access to this and you like to, you know, kind of take control of your health insurance, this is gonna be your best place to start. Medicare.gov can give you some information on when to enroll in Medicare, how to enroll, how Social Security and Medicare are related. But if you do not have access to a computer, or if you don't like using the computer, you'd rather throw the computer out the window, then you can call Senior Linkage Line, you can make a Medicare counseling appointment, but maybe start here and then call us afterwards and we can help. So this is a really great tool to get you started on your Medicare process. Now, John, I'm going to turn it over to you. John is going to come up here, and he's going to talk through Medicare.gov. And what I'm going to do is I'm going to make sure that my link for Medicare.gov is working here. Cross our fingers that everything works the way it should. And while I'm pulling that up, I'm going to tell you, I have the Medicare.gov website up on my computer, but it is not up on there. Here's what I'm going to do. I am going to stop sharing my PowerPoint so that I can pull up Medicare.gov.
There you go.
There we go.
There you go. Thank you.
See, I get there eventually. This is all about technology, right? We figure it out and, then it works great. But I'm going to just introduce John here quickly. John is a volunteer of Trellis, and he has been volunteering with us for over 15 years. He is very knowledgeable about Medicare. He does presentations for us, but he also does Medicare counseling, where he sits with people and he goes through this process of comparing plans. He knows how Medicare.gov works, and so he's going to talk through it, and I'm going to navigate through the website here for him. So John, go ahead.
Thank you, Amanda. I have to say a couple of things to begin with. I have been volunteering with Trellis for quite a while, and one of the reasons why I continue to volunteer, people like the staff members like Amanda, who have been really very patient with especially some of the technical changes that we go through with equipment and so on. And that's why I'm glad she's here, because I have trouble multitasking if I'm going to move a computer around. One of the things that I do really feel is so important when we go into Medicare.gov is to make sure you are in the official website. Because once you go into a browser, there's hundreds of different sites, and some of them may be, most of them are probably legitimate, but it's really, they aren't the government website. In other words, they aren't the official website, so they may not have the official information. So I caution that to make sure. The other thing is once you enter it through Medicare.gov or MyMedicare.gov, because you can set up an individual account if you wish, which means that you will be entering some information like your Medicare number and name and address and so on. That is really worthwhile to save the information that you have entered in the past so that you can do some comparisons. One of the things that one of the fellow presenters, volunteers, mentioned, and I've stolen that from her, is that Medicare is like an onion. And you take that onion and you peel that onion and you peel it and you peel it and eventually you cry. So as a counselor, and I appreciate what Amanda said, my knowledge does not mean that I have all of the answers. It just means that for the most part, I know where to look for those answers. And one of those places is Medicare.gov. And in Medicare.gov, there are several, as you can see, there are several areas to go. And Amanda, if you would just start on the right, I just want to give you an idea of what that is. Now, this is how to contact Medicare. We've talked about contacting Medicare locally through the Senior Linkage Line, and this gives you other information. One of the things that I do want to emphasize is that Medicare and Social Security are pretty much operate together. So the information is exchanged between Medicare and Social Security. In this, there's just some of that information on there to help you gather more. And I think there was one, I just want to see. Yeah, there's on right there, just what, it just, as an example, it gives you the state offices. You click on the state and you can find the information as to where the state Social Security offices are. I think we'll go back. I just want to make sure that we're within the time here. I think we'll go back to the previous page. Thank you. And another thing that is new, and this is brand new, and I have not, frankly, used it that much because it's not in my area of counseling, is the doctor and the, well, the doctor would be, but the doctor in the nursing home. And if you could just click on that for just a minute here. And this is finding providers near you. The other day I went into that, and you can navigate that to find a provider. Many of us have our own providers that we've seen for many years, and sometimes you want to find out, you know, is there a specialist that you're looking for, and so on. And you can do that by looking at the area that you live in. Much of what this is based on has to do with zip code or cities. And so if you do, as I do, live in a city that, in one of the suburbs that's pretty close to the other suburbs, you may want to make sure that you have followed, that you are also looking in those other cities. If, for example, you enter the zip code, which is mine, 55112, and it will pick up things in Ramsey County that are local to where I live, but it will not go to, for example, neighboring Fridley, where I do some of my medical business, or St. Anthony, and so on. So that's something just to be aware of. This is a national website, and it is something that it is not necessarily, it has Minnesota information and it has updated information, but it is again a national website. So what it's based on is what is on that map up there. So let's just look at, well, one of the things that is in Medicare.gov that I wanted to make sure and mention is something new: nursing homes, and listing various nursing homes in the areas that you live in. Now, I did a search on that, and again, I am not an expert in that particular area. I did a search on that the other day, and I was looking for nursing homes. Unfortunately, I did not find assisted living facilities. It doesn't mean that they're not there. I just did not find them in my area, and I know that there is at least one or two. So that's something that we, you know, that could be used as a tool, or something that you could use to go further by making phone calls and so on to the different institutions that you have looked at. And I always, anytime I'm counseling, I always caution that if there is any question, make sure that you contact the facility or the doctor or the clinic, and to make sure that they will cover you under the plan that you've chosen. So that's now let's go to the kind of the meat of it here that I want to talk about. Yeah, we're doing all right.
That time.
We're doing all right in time. Okay. We go into finding health plans. And this is something that, as Medicare counselors, we use a lot. It is something that has changed over the years, much like that first picture that we saw when we opened up. every time you open up the website, there's going to be a different picture, probably, not every time, but almost every time, there's going to be a different picture of somebody on the front. So don't go by whoever the person is on the front, the picture. So now, where we're looking is, there's two ways to go. The one on the left is if you have a Medicare.gov plan. And again, that Medicare.gov plan is not a plan, but a Medicare.gov, if you are logged into that personally, that has all of your personal information. So what we'll do is what we very often do, unless the person that we are discussing it with wants a Medicare.gov, is just go into the zip code. So if you want to just put in 55112, you can put mine in if you want, if you would please. And this will give you gives you Ramsey County only. If you put in other websites, other zip codes, for example, if you put in a 554 zip code, you may end up with more than one city, or even in a 551 zip code, you may end up with more than one city or town or county, and that's where that'll show up, is under there. And so you want to make sure that you look at that and enter whatever county that you're in, if that's appropriate to your search. And then what we're going to do is take a look at the next list. And the next list, and I have to kind of look at that too, yeah. Okay, yeah. Now there are three on the right side there. You see the three: Medicare C, Part D, and Medigap plans. Now Medigap plans themselves do not include a Part D. So that's one of the reasons why you see a standalone plan. But I'm going to ask Amanda to check on the Medicare C, please. And in Medicare C, there's a series of questions that are asked. They include, and you may be working with somebody, or you may be yourself, have some type of assistance, or you may be interested in what the cost difference would be if you have what's called low-income subsidy and so on. Otherwise, normally, if somebody is new to Medicare and we're not looking at anything, as an example, we aren't looking at anything regarding any type of assistance, type of financial assistance, we would either click I don't know, or possibly I don't have any assistance. So if you would do that. And then the preferences, I think that's the next question, right? Yeah.
Yep.
Yeah.
Do you want to see
drug
your
costs.
drug
We'll do
costs?
yes on that. So what I'm going to do is ask Amanda to enter two different drugs. And the first one is, well, let's do three. First one is Novolin, Novolin, which is, and some of you may know this, and some of you may know it much better than I do, is a diabetic drug. And I'm doing this for a reason. And then just the dosage. It doesn't really, it'll ask you the dosage, but for our purposes here, we're not going to, we're just going to pick a dosage, I guess. Okay, the next one that I'll have you enter is Jardiance, Jardiance. I was looking, as I was going through this, for a drug that is not a generic drug, is a brand name drug, and I thought, well, Jardiance would work, and so I just included that. And then the third one is Lisinopril, Lisonipril, and that's a pretty common blood pressure drug. Now that happens to be one of my drugs. It's a generic drug. And now what we'll do is we'll go to the next step, which is to find I believe that's the next step, is to find a drugstore. So if you would click on that, and it will give you drugstores within whatever distance you ask for from your location. That's a drugstore. It may be, in some cases, it may be a hospital pharmacy, may be a clinic pharmacy, that type of thing. One of the things that I'll do is just have you click on a couple of them. And if you do the mail order, please. There's a difference in mail order and drugstore, only that very often, although not all the time, mail order itself is a little bit cheaper, but it may or may not be, and that's something that you have to look at. So our next step is to, my eyes aren't, there we go. Okay, our next step is to look at, I think, sites. Yeah, we're on a site. Let's just take a look at this one. This is the first one. In other words, based on the drugs that we put in, and this is, I believe it's on 2024, yeah.
Yes, it is.
Then this is the drug, or this is the plan. And I'm not saying this is the plan that you want. I'm just saying this is the least expensive as you go through the plans. This plan has no premium for either the medical or the prescription drugs. This plan, as you'll notice, is, let's see, I'm just, you mind looking at that Humana plan?
Oh, isn't that what we're on? Humana Gold Plus.
Yeah, is that okay?
Yep.
Yeah. Okay, I just want to make sure. I can't, my eyes with the glasses and I aren't, so as we're looking at the plan, you'll notice that it does give you a cost. And if you could slide back up to, just back up to the, no, okay, that's a gold plan. Let's look at the cost, at the monthly premium, at the, oh, okay, I don't know where we're going. Hey, okay, I'm sorry.
It's all right.
Yeah, let's go to plan details.
Okay,
All right, thank you. Okay, let's go to plan details.
here we go.
Yeah, that's great, thank you. Now, that plan details will tell you what the costs are. And one thing I advise, whether you are talking to somebody or whether you are looking at it yourself, is to make sure that it's always recognized that even though Medicare C or Advantage plan is handles all of the billing from doctor and hospital, we are all still, those of us on Medicare, are obligated to pay that $164, or in some cases maybe more, for Medicare B. That is right on top of the cost. So anytime I talk to somebody and they say, well, I don't know whether I want original Medicare or if I want to have a Medicare C plan, I have to caution them to make sure to recognize that $164 is always part of the bill. It's on top. So this gives you, and some plans, and there are many, many plans, some of them are zero premium, like this one. But I'd like to have you scroll all the way down to the drugs. I think it's down there somewhere.
Here we go. Drug coverage.
Drug coverage, yeah. And let's go down, because I think we want to go, yeah, there it is. Okay, this is the cost. This is what it would cost for those particular drugs that we entered. Now you'll notice that the large amount is the Jardians, and that drug may or may not be a preferred drug, as the others may or may not be. But my point here is that there is a difference, and this will show you what the differences are. It will also show you, as we scroll down a little bit, what it's going to cost at different locations, and what it would cost you at different locations. And there is a way in here to check to see if you want to purchase on a 3-month basis or on a monthly basis. Normally, the mail order is on a 3-month basis. So let's scroll down just a little bit. There we go. And this gives you the monthly, what it's going to cost you each month for the drugs. One of the things that you look at and you see when you go through this is it a preferred pharmacy? Or is it in their network even? If it's a preferred pharmacy, that probably means that some of the drugs, and whatever drug you're looking at specifically, will be actually reduced in price because that pharmacy has whatever arrangement they have. So it depends on what the tier the drug is on. It depends on what the relationship is between the provider and the company that you're buying the plan from. And so there are several factors. And that's something that everybody should be aware of. Now, one of the things that I wanted to back up to, and I don't know if we can, I don't think we can get back there without going and re-entering, but was if you looked at the Novolin, when that's entered into the system, it pops up and it says that the drugs for diabetes will not exceed $35 a month, and that's the change that happened, actually happened this year. So there's been some changes in the diabetes drugs, and these are things that you want to make sure that if they're not in Medicare.gov, that you are aware of them. Now, we find occasionally, and I say occasionally, that there might be some sort of a mix-up or a delay in somebody entering something into Medicare.gov. But right now, this is the latest information that exists. We haven't hit open enrollment yet, and I have only been through part of the training for next year, so I don't have any of this really memorized yet. So that means that there can be occasionally changes, so that if there is any question as you go along, or if you are new to Medicare and you're new to Medicare next year, and it's toward the middle of the year, for example, you may want to double check those figures just to make sure that some of that hasn't changed. If a drug through the plan is, at the beginning of the year, is going to cost you X amount of money, and then you are in the middle of the year and all of a sudden they drop it from their formulary, they have to, or they don't have to, but there is an appeal process that says that if you appeal it, the company will honor that price for the rest of the year, or honor that drug on that tier, if nothing else. Because these are all tiers. And all of the tiers are governed by the companies, the insurance companies, as far as what they include and how much. Thinking that maybe what I'd like to do is have you scroll down just a little further into that.
And I think we've got about 1 minute left.
Oh, okay, well then, let's do this. I mean, I just wasn't sure how much time we had.
That's okay.
So let me just remind you that if you have any questions, if you get into Medicare.gov and you have any questions, call the senior linkage line, because there are people there who are much better at multitasking than I am in front of a crowd. So anyway, that concludes my part of the presentation, and I thank you.
Thank you so much. We appreciate it. And like John said, please give us a call if you need help. John is a very experienced Medicare counselor. We have lots of other Medicare counselors who do this work as well. So if you start this work, looking at your Medicare options and you get overwhelmed like most people do, call us at the Senior Linkage line and make an appointment. Because remember, we're free and unbiased, so we can really help you choose a plan that's right for you. So thank you for your time. We appreciate it.